What are the steps involved in research? I'm Dr. Pranav, public health scientist and author, and I will be discussing step by steps what all things we do in a typical public health research. So, number one, we acquaint ourselves with the domain experience, like we want to do a research on what are the interventions which can work best in prevention of HIV infection in a particular community. Now, to do that, I would first like to acquaint myself with all the other places where the works on intervention in HIV/AIDS has been done. So, I'll be referring to different research papers, different articles, different reports. Based upon my acquaintance, I come up with what I need to do in my community, but before doing so, I need to do right kind of small pilot studies, as well as I need to find out what exactly is the status of health and disease in my community. So I will be conducting a research. For that, I will be starting first with a particular formal research objective, like with my research what all things I want to investigate. Based upon my research objectives, I will come up with specific research questions. Now, to answer every specific research question, maybe one, maybe multiple different question can be included in my research tool of questionnaire. So I will be creating an exhaustive set of question in the form of questionnaire, where every question in the questionnaire is connected to my research question. So it may be sometimes that one research question has multiple different questions involved in questionnaire, or sometimes for one research question there is one question in the whole set of questionnaire, and my research question is going to answer what I am looking to investigate when I formulated a research objective. At the end, when I conclude my research, the first thing I will be doing is that I will be finding and connecting if I fulfilled all the objective that I set out with. Fine. After that, once we have formulated the questionnaire, we need to administer the questionnaire in my community. For that, I will requiring different members who will be conducting the questionnaire based survey. For that, I need to train them. So I will be conducting a workshop, I can be conducting a seminar where I will be training all my staff, be them volunteers or they are my professional employees. I will be training them how to collect answers to the question, how to deliver the context of the question to my subjects. After the questionnaire has been filled, the questionnaire has been collected, someone from my team will be entering all the data. So there will be extensive data entry. Post the data entry, with the help of statisticians and public health scientists, will be analyzing the data and finding out what are the insights. That's my conclusion part, conclusion of research. Based upon my analysis of the data collected, what have I concluded? How many number of people are suffering from a particular disease? Every year, how many number of disease patients are coming new? How many patients are treated every year? What are the different socio-economic factors which contribute to the causation of disease? If there is any behavioral factor, what are them? If there is any political factor, could we pinpoint which exactly are the political factors which are involved in causation of diseases? So with coming of the complete 360 degree of understanding of my community for a particular disease, I will be coming up with an understanding. Now I am ready to answer the objectives with which I started my research. Based upon my conclusions, I will be coming up with certain advisory, certain policy changes which I would like to recommend based only on my research. A very critical point to understand, many times international agencies as well as national agencies, they will like to put whatever they want to do based upon the evidences that has been collected, but sometimes it will be right what they wanted to say, but sometimes the evidences will say exactly opposite to what they wanted to do in the first place. But as a true researcher, you need to depend only on your evidences, only on the data that you have been able to collect. So finally, you will be coming up with your own policy recommendation, your own program recommendation, which needs to be done, and based on that, finally, we will be able to make right changes in community health. Thank you.